Good evening, this is Dr. Smith at Nephrology Associates. Wanted to take a couple minutes tonight and review with you some of the elements that we talk about regularly in our practice, our chronic kidney disease practice, and that centers on the topic of potassium. Potassium is super important and a super common topic when patients come into the practice. We like to keep the potassium blood level somewhere between 3.5 and 5.5, depending on the situation. Many issues come with potassium management simply because most of the medications that we use in our clinical care have a bearing on potassium levels, typically the ability or the concern to raise them. The problem with a potassium that is too high is that it is one of the reasons that people can get weakness and can affect cardiac function, particularly heart rate, and can cause death if the level is too high. So we spend a lot of time educating patients about potassium. One of the other things we like to take care of with initial conversations of this are common beliefs that are out there that, for example, cramps are always from potassium, and therefore we do see patients that come into the office that have liberally taken potassium higher amounts in their diet or taken potassium supplements at the pharmacy. We always educate patients to talk to us first before doing that. Yes, you can have cramps from a low potassium, but of course other medications can do that, as well as hydration states and other things. So we recommend patients contact us with that symptom. The problem with the high potassium, which is our biggest concern, is that many times it's asymptomatic unless it's severe. When it's severe, you can have low blood pressure, you can have, as I said, a slow heart rate, or you can have syncope or pass out. So the important part of potassium for our patients is that many of our medications that we use to treat kidney disease, particularly diabetic kidney disease, affect potassium levels. When our patients come into the office, many times they are on medications that affect potassium. So you commonly have heard these terms. These are medication classes that we use for heart and kidney patients very commonly. ACE inhibitors, angiotensin receptor blockers, and mineralocorticoid blockers or mineralocorticoid antagonists. We like to call those ACE, ARB, and MRA or MRB. They do have some common endings. For example, ACE inhibitors always end with the word pril, P-R-I-L. ARBs end with the word tan or T-A-N. And then the receptor blockers end with one, O-N-E. So look through your medications, understand if you're on this class of medications, and particularly pay attention to the fact that these medications do affect your potassium levels. They're super important for retarding the progression of chronic kidney disease. And you've heard about some of those things already in other talks, and there may be some more information coming shortly with our lectures about emerging therapies that are additive to maybe what you're already using for your chronic kidney disease therapy. Our patients commonly do better when they're educated, as do all patients, and we also go to the effort to make sure their physicians are educated. For example, if I have a patient on one of these medications, I always tell them, after we've educated them about potassium, make sure you call us if your physician wants to stop this medication. That will allow patients to continue to have therapy, which will continue to give them the best care available to slow the rate of progression of chronic kidney disease. The other part about potassium and other medications that can affect this, and we talk about this always in our office, is do not take medications over the counter for pain unless we have reviewed it with you, or unless it's acetaminophen. All of the non-steroidal medications, the Advils, the Aleve, the ibuprofens, will affect potassium levels and can cause problems with a high potassium. Lastly, we spend a lot of time on diet issues. We talk about citrus, we talk about bananas, we talk about potatoes, and then we talk about seasonal fruits always being an issue with higher potassium levels, particularly in the summer months. So today I want you to just take home the message that potassium is super important. I ask that you don't make any assumptions regarding if something is beneficial over the counter or not for cramps. We always recommend that you contact us for clarity on this issue. Understand that when your nephrologist tells you this medicine is super important to prevent progression of kidney disease or slow down the rate of progression of your kidney disease, that's a big deal. And so understand what your medicines are for, what they're treating, and how they can affect potassium levels, and that will give you a tool in the tool bag to help yourself as a patient. Thank you for your time.